Hello and welcome to the Nurse Rosa's Insights podcast. I'm your host, Rosa Hart, and today I am joined from the exotic regions of Alabama by Zaman Shah, the founder and CEO of Medway. He's a physician and entrepreneur now. And so thank you so much for taking the opportunity to join me today.
Thank you, Rosa. It's a pleasure to be here.
Yeah, we met at Health in Vegas,
Uh,
and my policy is what happens in Vegas does not stay in Vegas. 'Cause
Opposite policy here.
yeah, don't do anything you don't want everybody to know about.
Yeah.
So, so tell us a little bit about you and your background because I'm in Louisville, Kentucky, and we were talking ahead of time because you actually spent quite a bit of time in Kentucky going to the University of Kentucky for med school, right? Or was it a fellowship?
Residency training, yes.
Mhm.
Yeah. So I'm a physician for over 15 years, working both on the front lines and a leadership role. Trained in internal medicine at the University of Kentucky, and I was there for almost 9 to 10 years, practicing in the Lexington area. And then I moved to Alabama in 2020, so it's been nearly 6 years here. Have background in business and healthcare AI, and I'm passionate about leveraging AI to tackle problems of inefficiencies and unifying fragmented data in healthcare. Because at the end of the day, it's all about improving healthcare and restoring the human connection in healthcare.
Yeah, exactly. And I think a lot of people are surprised to hear that when they come into this healthcare AI space, that that is the real priority, at least for the clinicians involved in development, because it sounds like, oh, they're just making robots and making it hard and sterile. But that's not how we see the possibility. But you said that you have background in business and AI. When did you have time for that? When you were training to be a doctor
Uh,
and working?
I have been, my practice has been more heavy in the last 6 years, more on the outpatient side. And
Mm.
I did make time to do an MBA from the University of Alabama, Birmingham, and in addition, did formal education from Harvard in healthcare AI and digital transformation. Obviously, this has been a long dream for me to use technology to solve real world problems in healthcare. And I think in order to have the right tools on hand, it's best to, obviously I had the domain expertise in terms of being a physician working for, a long time, but at the same time, that business background and the healthcare AI education was really that ingredient that allowed me to put whatever I had in mind into a structure and build the momentum in the business I needed to do.
Yeah, so did you move to Alabama to do that MBA program?
It came right after, actually, when I moved to Alabama. It was a bit of tragic circumstances. I had a relative who had practiced here, and he passed away in a car accident. And
Oh,
so I moved over to basically start taking care of those patients.
wow.
But obviously, so it was a bit of an unexpected transition for me. I was more heavy on the inpatient side when I was working in Kentucky. But, when I was on the outpatient side, I loved practicing outpatient and connecting with patients and, like seeing them on a more regular basis. While at the same time, good thing about this was that I had more time on hand to actually do the additional things that I wanted to.
Yeah, and so if you were seeing people outpatient and inpatient, was that still part of like a health system that was handling all the business administration side and then you were confronted with it when you got to Alabama, or is that like
So
something you were working with
I
already?
was on the hospitalist side when I was in Kentucky. And when I moved here, this was a traditional internal medicine practice where you go to the hospital and see your patients there, but it's predominantly heavy on the clinic side. So it was more so like the traditional sort of 8 to 5, Monday through Thursday, half day Friday sort of work schedule that I had. And really the time that I had was more so in the evenings and over the weekends and maybe perhaps Fridays to actually work on additional things that I wanted to.
Yeah, and was it your plan to go get an MBA, or did moving down there really serve as the catalyst and impetus for that?
It definitely served as a catalyst because initially I wanted to, but I never had the time to. And I think this really allowed me that opportunity to do that. Plus, the one thing that I was looking at, it was sort of coinciding with as the technology was advancing, I realized that there was definitely a potential for technology to solve, inefficiency problems in healthcare. It was in that context that I realized that this is the right time because the technology is growing and refining and maturing. And if I have the right background, both understanding of the business side of things as well as the technology itself, then I will be in a much better position to do what I want to do.
So was there a use case idea that you were like, "I wish this technology existed?" Or was there a use case where you saw a technology being applied that you were like, "Wait, I didn't even realize it could do that. What else can it do?" So, like,
So I
what is that for you?
Yeah, in my case, I would say this was, what I saw really is a growing disconnect between the purpose and day to day reality of healthcare for physicians and all clinicians for that matter. When
Yeah.
we sign up, we want to be there for the patients, help them out in their most vulnerable moments, make decisions. But more increasingly, we find ourselves in front of the screens working on computers, disconnected from our patients, working on tasks like documenting and searching and clicking and compliance and so many other things. And as the technology was advancing, there was definitely a potential for technology to be that silent layer that works or takes care of the redundant, non-intellectual parts of our work, and really allowing or enabling physicians to be more present, to be more informed and connected with the patient. And that was really, a dream I had, and that transformed into the idea of Medway eventually.
I love that. So
Yeah.
then what is Medway?
All right. So Medway is a healthcare AI company that basically focuses on the problem that I talked about: inefficiency in care delivery and fragmented data access, restoring or unifying access to data. So basically, what we do is we provide an AI infrastructure for electronic health record systems. So we work with them in collaboration, basically allowing them to provide their clinicians with AI features that include things like access to information. So, like a chat based access to information rather than me sitting in front of a computer and looking through a patient's chart and try to dig for information. I can just simply ask, and that information is delivered in the most intuitive and visually informative way. Like, for example, if I'm seeing a diabetic patient and I have to dig through the chart to find out what their A1Cs were and how their diabetes control been, I can simply ask that question and it will show me a single line plot with their A1Cs plotted for the last 5 times. And, that gives me
Yes.
an instant snapshot of how their
Friend.
diabetes control it. The same way blood pressure, kidney function, anything.
Mhm.
Basically improving that data access at the point of care, making physicians more informed and data driven in their decision making. The second thing is actually making that process reversed to improve efficiency. And that is like basically the order entry process, automating that. So instead of me making multiple clicks in the EHR to send the prescriptions to a patient pharmacy, I can just say that to a physician, like to the patient, that you have a sore throat and I'm going to send in this, let's say, amoxicillin, and it goes in, it looks for their allergies, it looks for drug interactions, and it goes ahead and plugs in all of those boxes in the EHR, waiting for me to review, approve, and a one-click submit. So, a big time saver there.
Oh,
And
yeah.
the
So
last
then you're integrating that ambient AI that a lot of people are using for charting to actually pull up those orders so that you don't have to go hunting and pecking for everything.
Exactly, exactly. So it's basically that ambient AI, using it for retrieval, using
Mm.
it for order entry, and at the same time we provide the documentation layer as well for the scribe part. So really the way I think of clinician workflow is we need to ask, know, act, and document. So it's that entire loop of knowing about what the patient has, prescribing or acting on what we need to do, and then closing that loop with the documentation process. So automating all of that around the clinician workflow, that's what Medway does.
That's awesome. I really love how that has the potential to smooth over those processes. What form of like where are you at in the development of it? Like, is it implemented anywhere yet?
It is actually. We have already implemented it in an electronic health record already. So basically, initially, when we started off, we were thinking directly facing a clinician, but we quickly realized that the true value comes from integrated solutions. If I, as a physician, has 5 windows open and switching back and forth between the windows and copy pasting, it creates more friction and lose loss of time rather than gaining value. So in that case, what we did was we decided to actually partner up with electronic health record systems and enable them providing that technology within the EHR itself in a native environment where the user doesn't have to move out anywhere. They don't have to learn anything new. It's just their workflow has been made a lot more efficient. And we already are integrated with an EHR. It's an ambulatory care EHR, a regional ambulatory care EHR. And very recently, in the last 4 to 6 weeks, and we're seeing a great response so far. We're also in the process of integrating with another specialty focused EHR that's more focused towards optometry and ophthalmology. So
Mm.
really what we're trying to do is to focus on not really the big giants in the industry like Epic or Cerner, who already have big vision and the resources and technology to do this on their own. But we are trying to make this technology, this essential AI technology, to the EHRs that perhaps don't have the time or capacity to build it from ground up. And so really to make sure their clinician users are not deprived of this essential technology, we partner up with them and deliver it to them.
That's awesome that you can find like a gap in the market because I mean, people have heard of things like this happening with the larger systems, like you mentioned with Epic. And so it sounds like, oh, well, you have an electronic health record. They should all do that. But what you're saying is they don't all do that.
And, um,
So that's
Yeah,
really great.
in my personal practice, like when I was going to the hospital here, I was using Cerner and I could see that they were having things coming along and transforming and improving at a rapid rate and had a bold vision of changing. But in my clinic practice, I was using a regional ambulatory EHR, and it's a far different dynamic there because the resources are limited, and building AI from ground up, you don't just need time and resources, you need there's a lot of compliance and security layers to it, and there's a critical talent gap as well because you need people who have information at the intersection of technology, informatics, security, and all of those. And so obviously it's not an easy thing to do that from ground up, and that's why there's that critical gap in the market that exists. And interestingly, these I would call them like small to mid-size EHRs and specialty EHRs. There's hundreds of them out there in the market that are serving physicians, clinicians in the U.S. market. Roughly around 675,000 clinicians in the US are dependent on these EHRs. And obviously, enabling them to have that technology available for their users is a huge thing that we can do.
Well, I love this, and I definitely want to make all the clinicians' lives easier. So I hope that that is rapidly implemented and it works really well. So I really want to tap into our $1 billion question with you. We talked a little bit about it ahead of time, but
Yes.
Zaman, if you were given a grant for $1 billion to meet a need that you see in healthcare, how would you like to see it used strategically to have the most sustainable impact?
That's an amazing question, and yes, I would love to have $1 billion to to invest. But coming to your point, I think the first thing we need to acknowledge as a country spends more than $5 trillion on healthcare, and about a third of that is actually lost to inefficiencies and fragmented data access. And that is exactly what my focus is. And that's where Medway's focus lie as well. So basically, what I would do is I would prioritize an AI-enabled operating layer, a technology layer that really removes the wastes coming from redundancy, fragmented data access, and manual administrative workflows. And so that is exactly where the focus is. So the first thing I would talk about is interoperability, to have nationwide standard-based interoperability in place where both clinicians as well as patients have access to their information, and to make it available at the point of care. And in fact, that's one thing that Medway is doing already as well, where we are trying to not just make the information from EHRs available, but we're also in the process of connecting with HIEs and the nationwide exchange of TEFCA to have that information also available for clinicians at the point of care to drive decision making. Obviously, that's going to remove a lot of redundancy, repetitive tests, and so much inefficiency. The second part is really around the manual administrative workflows that are taking so much of clinicians' time. I was looking at one study where it says that in a given day, really 25% of a physician's time is actually spent on direct patient care. The remaining 75% time is actually dedicated to documentation, dealing with EHRs, compliance, quality, and so many other things. So obviously, there's so much room, around that, and really, just like we talked about, making data access easy, automating things like order entry, automating documentation processes. This can save so much time, make the system so much efficient. And really, the important thing is that it is going to make the engagement between the patient and physician so much productive, so much connected, restoring that human connection in care, because the physician is going to actually be more present and engaged in that conversation rather than focused on dealing with the computer or worrying about the documentation. At the same time, making that decision making so much data driven, because now the physician has direct access to information at the point of care. The last piece to that is also technology on the patient side as well, to make sure their administrative burdens are relieved, they have access to their information as well. So that would be a priority for me with that $1 billion.
Well, that's fantastic because that's exactly the kind of thing that, I'm looking to hear about is what are things we can implement like as processes that will have that downstream effect and continue to be effective. Like if you get $1 million and just no more towards that, heaven
Yeah,
forbid.
right.
Like
Yeah,
what can you put in place that doesn't stop when the money runs out or can generate income so that it can be sustainable?
Yeah, so that's the interesting part. Once you implement these processes, they increase productivity and ROI. They improve the system efficiency. So that is the interesting part, because it's not only just improving the quality of care or outcome or experience for the patients. It's at the same time improving the life of clinicians as well, job satisfaction, reducing burnout, doing all of that. But alongside that, interestingly, it is also saving time. It's also making the clinicians
Mhm.
more productive. Like just with, Medway solutions so far, on the preliminary information we have, we're seeing that a clinician using that technology actually has roughly 25 to 30% more time at hand to see additional patients, to have more revenue generation, while at the same time having improved care outcomes and elevated patient experience. So that's the beauty of implementing technology as a silent layer in the background to take care of inefficiency and redundancy, is that it elevates care experience, but at the same time make you more productive and improves ROI. That is going to make it sustainable and continue as we go.
And to clarify, in this case, the AI is not making clinical decisions or actually prescribing anything. It's helping the information come together quicker for that clinician to have a better, efficient process, but they still are the ones looking at it, verifying it, and approving it to ensure the quality, right?
Absolutely. I mean, my vision for AI is not really replacing clinicians. It's actually empowering clinicians. It's allowing them to actually do the decision making, to do the intellectual work and be present and engaged with the patients, while the AI takes care of all the redundant, time consuming administrative parts of the work. Just an interesting thing I was reading once on LinkedIn is that somebody was saying, I don't want the AI to do my arts and crafts while I do the dishes. I want the AI to do the dishes so that I have time to do my art.
Mhm.
So that's really
Exactly.
where all of it lies, that we want to have the intellectual work done by the clinicians while AI is enabling them, allowing them time to focus on that.
Beautiful. That is the goal. And so I really hope that we see more of that. And I think we are seeing a lot of it. And then, we're seeing some mistakes out there with certain states letting AI go ahead and make these decisions and refill prescriptions, but not in Alabama, right? So,
Not in Alabama, but one thing I would say, I think that could be the biggest mistake because there's tremendous role for AI technology in healthcare, but that is only if done right. If we make sure we are taking care of the safety, security, compliance, we are making sure that this is the enabling layer that brings efficiency rather than think of it as a replacement for clinicians. That's where we gain patients' trust. That's where we actually see more efficiency coming into the system. Otherwise, if done wrong, we can erode that trust and really eliminate that tremendous potential that this technology could have in healthcare.
yes, so we do not have an abundance of trust that is disposable. We need all that.
It's true.
Thank you for taking your time out on this snowy weekend that we are recording on. And if anyone wants to reach out to you to talk more about Medway or just AI in medicine in general, how can they best get a hold of you?
Certainly, I could share my email. They could reach out to me via LinkedIn, or they could access our website. That's medway.ai. Any of those ways could be a way to, and I would love to engage in any conversations, any questions that I can answer, and just to share that vision and enthusiasm of restoring the human connection in healthcare with them.
That would be fantastic. I will include your contacts in the show notes. And then for our listeners, if you enjoyed this episode, and please like and subscribe wherever you're listening or if you're watching on YouTube. And if you know of someone else who has $1 billion idea to transform healthcare, definitely send them my way. You can contact me on the different social media platforms at Nurse Rosa Speaks or on nurserosaspeaks.com. I'm also on LinkedIn, and all that will be in the show notes. So I hope you will connect with me, and I'll see you in the next episode.